Hey, welcome to my channel, Running in Rehab. My name is Brett. I'm a third year DPT student, and I'm here to talk to you guys today about how to get through PT school, because PT school can be stressful at times, but here are the top 3 ways to relieve some stress and not only get through school, but kind of dominate when you're in school relative to your classmates or um, impressing the professors and things along those lines. So the number one thing that you want to do is keep up with your physical fitness. So whether you're into weightlifting, whether you're into yoga, whether you're into running, I tend to do all three, but running is kind of my main form of physical fitness. These physical fitness is going to help you to keep your stress levels lower. So, like I said, physical therapy school is stressful, so you want to try to keep your stress level lower, and maintaining good physical fitness can improve your confidence when you're going in to take exams. It can increase your focus when you're studying. So and it reduces your stress and keeps you sane and keeps you getting through school and dominating school. So that's the number one thing that I can tell you guys is maintain your physical fitness. And we're gonna throw diet in there as well. So keep your diet in check and crush your physical fitness, and it will really help you. I know it's really helped me get through physical therapy school. So guys, have some stress-free hobbies. For me, physical fitness is going to be a big one because of the cognitive benefits, the increased focus, and the lower stress levels. While you're doing these physical activities, whether, again, weight training, running, yoga, keep in mind your anatomy and your physiology and your biomechanics, how things are working. Because this is not only going to make the physical fitness more entertaining, but it's going to help to go over these concepts that you're learning in school. So for instance, if I'm doing a bicep curl, right, you can think about which muscles are performing this action. Where do these muscles attach? What nerve is innervating these muscles? It's not really an example. I use it as a runner, but during my running, I'm thinking about where's my foot landing? Am I landing on my forefoot? Am I landing on my heel? Am I landing under my base of support? Am I hitting any sort of pronation? Am I landing too supinated? Am I not pronating enough on one side? Am I feeling my big toe being utilized? How's my form? How's my breathing? Become hyper aware of your body, because now you have the knowledge to understand which muscles are firing, which muscles aren't firing, or which muscles are over firing. If you have an ache or pain, what may be causing this ache or pain? Now you're becoming your own PT, and you're fixing yourself. And if you can fix yourself, I would think that that's a good indication that you're going to be able to help others out as a PT. So it's going to help you out. It's going to make you a better practitioner, and it's going to help you pass exams because you're applying the knowledge that you're learning in school. So I'm also going to add on to that, I'm continuing to work. My physical therapy program is a weekend program. So I go mostly on Saturdays and Sundays, spend all day Saturday, all day Sunday there at Newman University. And so I'm able to work, and I work at an outpatient clinic. And again, going over those concepts in clinic, I'm going over those concepts during my physical activity. So saying all this to say, if you're going to go to PT school, you might as well dive into it, go fully immersed into it. And again, it'll help you to gain an edge over your classmates, and impress your professors if you care about that kind of thing. But the biggest thing for me is just becoming the best practitioner that I can be in a short amount as possible, maintaining my health, and learning as much as I can, and passing boards, which I'll be taking in about a year. So, and then lastly, as we know, or as you may know, PT School, it prepares you to work in various settings within the field. So you can work in the school system, you can work in a hospital, you can work at a long-term, an acute care, skilled nursing facility, outpatient clinic, sports-specific clinic. So there's all these different settings, and physical therapy school is going to prepare you for all of those different settings. All that to say, you're going to be put into courses, you're going to be taking courses that you may not be that thrilled about, or may not be that interested in. And it's really important that you see these courses as an opportunity to learn, as an opportunity to expand your knowledge, as an opportunity to potentially enjoying one of these courses, or maybe exploring that, a certain setting. I know that I'm saying this because I went in with the mindset of, I'm going to be an outpatient PT. I'm interested in sports, but definitely outpatient stuff. I'm not really that interested in neurologically, spinal cord injured, brain trauma patients, hospital patients. As I go through school, though, I'm keeping an open mind, because it's all physical therapy. And maybe I work at a hospital for a couple of years, and maybe that makes me a better outpatient PT. We look at one of the pioneers in physical therapy. Her name's Dr. Shirley Sarman. She worked with spinal cord injured patients and saw how much the neurological system was involved in outpatient and everyday people without spinal cord injuries. So she was able to apply what she learned in the neurologically impaired patient, and now she is writing books about how outpatient clinicians should view and evaluate their patients. So you never know where life may lead you. Maintain an open mind during these courses, or just see them as barriers to getting your degree. Right? You want to get your degree. You got to get through these courses. So grind them out, and might as well learn along the way. Learn as much as you can along the way. And that's how my last point. So just to conclude this video, my last point is, you're in school, you signed up for this, you're paying all this money. Take this time to learn as much as you can. That way, when you're graduated, you can progress the ladder, whether it's financially or into a managerial role. You can impress your employer. You can get your patients better, quicker, and you're never going to be done learning, but you might as well learn as much as you can while you're in the learning phase of your career. And that's the mindset I'm taking, that I've tried to maintain throughout physical therapy school, which has really helped me got me this far, and I'm going to continue to learn and apply this mindset. So just to conclude, physical fitness is the most important thing to keep in mind to get you through your PT program. It's helped me. It's been a necessity for me to maintain my physical fitness, maintain my diet, maintain my sleep, maintain my physical fitness, and then applying the knowledge that I'm learning in school into my physical fitness, into my workouts, into my yoga, stretching, and that way I'm just continually thinking about the information and making it relevant to working out, walking, everyday life, thinking about anatomy and biomechanics. And then lastly, keep an open mind during your ancillary courses or courses that you may see as not as important or ancillary, and keep an open mind and see that they're a barrier to getting the license. So push through them and learn as much as you can. But I hope this helps you. If you're just getting into PT school, if you're in PT school now, I hope this helps you. And if you have any further questions, leave a comment down below or reach out to me directly. And I'll see you guys on the next one.